Hey everybody, welcome back to the View from the Top podcast. This is Nico Hill. I had to do a podcast today about COVID and these vaccine passports, these restrictions, and we're going to start in Australia today. Australia has fallen. It's a fallen nation. It's a fallen country. It's a penal colony, and we'll go through here just some videos and some things before we get to America. So here we have a notice that went out in southern Australia. Um, they have moved to a whole nother level. By the way, their death rate is in the single digits, while their cases continue to rise, regardless of all the lockdowns and the measures that they put in place. So as we go through this, just understand that. South Australia also has broad powers under its major emergency declaration, which has recently been extended until September 19th. Officers can break into any land, building, structure, or vehicle using whatever force necessary, direct or prohibit the movement of people, animals, or vehicles, put people in a quarantine, order people to undergo medical exams, tests, or treatment, and compel people to give information. Police in uniform don't have to show their credentials before exercising these powers. Yeah, this is the type of country that Australia has become. Here's a video that came in that's going viral today, and just listen to the tone of these people that look at other human beings as their property.
No one's being coerced, no one's being unreasonably pushed here. We've opened up the operational availability of vaccines, but that decision making is with you and a trusted health professional to advise.
There will come a time, though, where I think restrictions will apply to those who have not been vaccinated, rather than restrictions applying to all of us. Now, if that's not an incentive to go and get vaccinated, I don't know what is. But I can see a time when to get into a venue, to attend a major event, to participate fully as a customer, a client, a ticket holder, a patron, a viewer, however you want to look at it. Being vaccinated will mean you get in, and not being vaccinated will mean that you don't. And some people will be all up in arms from a civil liberties point of view. Well, that's not the issue here. The issue here is keeping people safe. And there will be a percentage of the community who cannot, for medical reasons, be part of the vaccination program. We'll need to make sure that they've got a passport of their own that demonstrates that they haven't chosen to ignore the advice. They can't be vaccinated. Then there'll be a whole lot of people, hopefully 80+% of people who have got the jab for themselves and for everybody else. And then there'll be a small number of people who choose not to. I would commend to everybody that these vaccinations have been through a rigorous process, globally significant rigorous process. Getting vaccinated is not just how we get to the other side of this, but getting vaccinated is how we save lives.
Yeah, so that's insane. There's really nothing else to say other than these people need to be stopped. They need to be shamed. They need to be stopped. They need to be taken out back, and they need to be arrested. I don't have anything else to say about them. That's what needs to happen. They've moved to also this building. This is an official letter to a resident of an area of Australia. You can't really read it, but you can look it up, and it's telling them that they're going to be building a quarantine center in their area. Well, where they will house people in quarantine. It'll somehow look like a hotel, but it'll be a camp. This is a camp. That's what this is. And they're building it on taxpayer money, and they will compel people to go in it. And they will not be able to leave until, I'm guessing, their quarantine is over, which is an indefinite number if you're the government, and you probably have a negative COVID test. The project summary: with quarantine continuing to be a critical part of the Australian response to the COVID-19 pandemic, the Victorian and Australian governments have committed to building a purpose-built quarantine accommodation hub outside Melbourne to combat and protect the community from the highly infectious COVID-19 virus that zero, maybe 1% of the people who get it die from. In here, they call this the Center for National Resilience. If there's nothing more Orwellian in the world, I don't know what there could possibly be. Then we move to this, which is almost another level. The Australia, they're going to put children in a stadium and administer the vaccine to them without their parents present. And of course, you have Big Brother or Big Sister here on the screen telling them everything is going to be okay. If you do not believe me, here's a video that you can watch.
I want to stress that to the mums and dads, your children will be well looked after inside when they arrive. They'll be literally ushered. We'll have nurses, we'll have some of the youth command, we'll have some of the young police from the various operations within police there just to guide them through as to where they go. They'll be looked after every moment inside the stadium, and they'll be well cared for. So mums and dads feel secure. We've got about 24,000 students we're aiming to get through next week. The messages will come out this week, and the opportunity is there, but really you've got to take it, grasp it with both hands. I know if you talk to any of our Olympians, they'll tell you, you just got to grasp opportunity, and this is an opportunity, so don't waste it.
That is beyond insane. 24,000 children in the stadium, no parental access. The children will be well looked after. There's nothing I can say. There's no rational response to this other than to be against it vehemently. And I'm done. If there's any people out there that are for this kind of stuff, make yourself known. And your neighbors know not to speak to you, not to provide you with any personal or private information about themselves. They keep their kids away from you and their opinions, because you are a brown shirt and you should be shamed from society. Moving on, more Australia.
On the back of contact tracing information, went to a home in southwest Sydney yesterday morning and found a person that should be there, wasn't there.
It appears that this little piggy went to market, and this little piggy should have stayed home.
Long after, that person returned to the front of the house in a motor vehicle. That person was spoken to by police and ADF, was issued a penalty infringement notice, stated that he'd hopped in his car and went out for some fresh air.
And getting fresh air is against the guidelines.
The point is that if you are going to behave like this...
And by behave, I mean basically breathing freely.
So if you're going to step outside the health orders, you will be checked on and you will get an infringement notice, and that person will continue to be checked on and make sure that they comply.
So there you go. That's Australia for you. Moving over to New Zealand, who, if you noted today, they are going back into lockdown after one COVID test came back positive. And this is what some lady in charge over there had to say.
Stay local and do not congregate. Don't talk to your neighbours. Please keep to your bubbles. It comes down again to those very simple principles. We know from overseas cases of the Delta variant that it can be spread by people simply walking past one another. So keep those movements outside to the bare minimum, wear a mask, and make sure you keep up that physical distancing.
Don't speak to your neighbors, don't make eye contact, stay inside or we'll kill you. That's pretty much what you should have said. These are government officials. I expect this from them. What I don't expect is people that, and we're going to get to New York, normal people are for this. They're for this stuff. All right, so now today is the New York Passport Day. So we have this comment here. It's absolutely hilarious that New York's moronic, useless vaccine passport system starts on the day that the government announced booster shots, meaning that those with 2 shots are no longer fully vaccinated. So again, the vaccine passports are nonsense. If you have antibodies, you should be able to go in. If you're unvaccinated, you can't harm vaccinated people. That's what they say. So why are you banning unvaccinated people from any of these things other than you're forcing them to comply with your nonsense and punishing them for not complying? That's all this is about. So in New York, you now need to provide an identification to enter most indoor places. You don't need an ID to vote, and not that I'm a big fan of voting, but now you need to carry an ID and make sure you give it to get into anything because your ID needs to match your vaccination and passport. In order to enter venues covered by this rule, you will have to show ID along with proof of vaccination. Um, Tim Fool, who I don't like too much, did some real journalism today, and here we go. On the phone with New York City via 311, and I'm told there is no medical exceptions for the COVID vaccine mandate. I've read the uh, the executive order, and there is no medical exception. Tim Pool mentioned on one of his videos, and I believe it, and I wouldn't be shocked. And it's just one example. He knows somebody who has multiple sclerosis, and she cannot get the vaccine. So when he called the city and asked them, would she have a medical exception to get in and do things indoors, um, they said no. So she's just banned from New York. Discriminatory, banned. Um, it's this needs to be fought to the point where cops. We need Black Lives Matter riots over this. If you live outside of a New York or LA or Australia or New Zealand, do not go there. Do not provide them with any financial. I'm sorry if you live there. I'm sorry if you own a business, but that I mean, it's not. No, no. That's it. We're putting sanctions on you. Like in France, where people are not going to these restaurants, they're not going to the grocery stores. This is it, man. That's it. We need them to show their true colors and get out there in the streets and try to start beating people with sticks and see what happens. This is over, man. We're done. And a New York City lawyer told me they are getting hundreds of calls about the vaccine mandate. They didn't elaborate on the circumstances of the calls, but I was asking about medical discrimination. So far, I've called 14 restaurants asking if they mandate vaccines. 12 said yes. They also said people with medical conditions preventing them from getting vaccinated will not be allowed in. One said it's fine if you're medically exempt. One said they won't check at all. I'm calling more. One said it's fine until September 13th. One said it's fine for now, but next week, no dice. One apologized profusely. Every restaurant has blamed the city and said they are just following orders. So this is the wokest city on earth. These are the moral, virtuous, liberal, know nothing people who lecture us all the time about how we have to be inclusive and we need equal and equity. And they are the first ones to protest for minorities and left handed people and people with one arm. But with this, they'll just follow the order of tyrants. They're the first ones to call everybody else fascist. But with this, they're the first people to demonize and to go about whatever they're told and ignore their neighbors as they're suffering. Fuck those people. Then we have this, as they're trying to tell you that the nurses are overwhelmed and the hospitals need help and we need to get vaccinated, blah, 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 blah. We have this. Please don't share my email address. I work at a child's hospital in Orange County, California. We are mandated by the state of California to be fully vaccinated by 9/30/2021. If we're not vaccinated, we will receive a 5-day unpaid suspension until October 1st. If we don't get our initial vaccination in that 5-day time span, we are terminated on October 6th. There are currently 70 nurses refusing vaccination. That unit will be in bad shape if they lose 70 staff members. Many nurses in other units are also refusing. Management is also telling staff that they are not even allowed to speak about the vaccinations at work. The other part of the California healthcare mandate is that Hospital visitors are required to provide proof of vaccination or a negative COVID test to enter the hospital. The administration decided to change the name of our visitors, that means visitors of the nurses, to care partners, and they are exempt from showing proof of vaccination or a negative test. So you're forcing young, healthy employees to take a vaccine. They are going to allow visitors into the facility without the same mandates. My organization actually just added a resignation code for coding of vaccination mandates. They are also adding an involuntary one. Vaccination rate at 78% for my organization, 2 hospitals with approximately 3,000 employees. They are already at critical staffing shortages, as this is see other forward emails, and they are anticipating chaos on 10 when the mandate goes into effect. So the hospitals are, and again, this is the correct thing to do. Choke them out. Threaten them with their jobs. Threaten their money. And while all this vaccination shit is being pushed, we have these kinds of things. This is a breakdown of Israel and a place in India. In India, they are giving ivermectin to all new cases, or as many new cases as they can, and there you have the breakdown. The population in millions. Israel has 9 million. This area of India alone has 230 million. Percentage of fully vaccinated: 62% in India, 6% in India. Tests per 100,000: 140,000 tests, 200,000 tests. Cases: above 8,000, close to 9. 17 cases, 1 death to 18. Still in the 18 deaths and 8,000 cases. These people are out of their minds. And you can prepare for the media blackout because Japan is getting hammered with cases, and they're now calling for immediate use of ivermectin as the cases surge. So the U.S. will completely not talk about Japan anymore. And even in the United States, as we look at this map from Our World in Data, which I use every day, if you look at the bi-weekly change of confirmed cases, which is how you would graph a surge, which is the bi-weekly growth rate at any given date, measures the percentage change in the amount of new confirmed cases over the last 14 days relative to the number in the previous 14 days. So this is how you look at a surge. The United States, which you see on there, is coming down already while they're pushing this stuff. There is no science behind what they're doing. This is not for anybody's safety. This is pure totalitarian compliance pushing. And if you have people in your lives that are going along with this, provide them this information. And if they deny it, cut them out of your life. Do not give in to them. Do not give in to social shame. Do not give in to feeling bad or whatever. They are criminals, and they need to be held accounted for. Okay, that's it. I'm done for today. I'm gonna take a day, hopefully tomorrow, off, but I'll be back. I'm not gonna stop with this until this is over. This is only gonna get worse until we threaten these politicians' jobs and we just choke them out. Force these brown shirt friends of yours to see that they are on the bad side of history. All right, till next time, this has been Inigo Hill, a View from the Top podcast. I'll see you guys out there.